Hi everyone, my name is Richa Rising. I'm an adult gerontology nurse practitioner program. My research study was barriers to cardiac rehab in rural communities. Cardiac rehab has shown to decrease mortality rate of people with cardiovascular disease. However, only 70 to 80% of those people receive cardiac rehab. My study was to look at how patients' ability to overcome adversity correlates with cardiac rehab barriers. The patient's ability to overcome adversity was assessed using general self-efficacy scale, and cardiac rehab barriers was assessed using a cardiac rehab barrier scale. Both of these tools are validated. The theory that guided my study was social ecological theory. Not all components of this theory was analyzed in my study. I went to three different locations in rural Iowa. They were Mount Air, Grand River, and Osceola. Participants were recruited based on if they had coronary artery disease, heart failure, CABG, stent, valve replacement, um, or pacemaker placement. My study showed that there was no real correlation between cardiac rehab barriers and general self-efficacy. Some of the interesting findings were that men did have increased self-efficacy, meaning that they were able to overcome adversity better than their female counterparts. However, they also had increased barriers. This could be because my study was mostly in rural communities, and rural communities have shown to have increased barriers than urban dwellers. Other findings was that there are several barriers to cardiac rehab that my participants stated, and they were family obligations, cost, travel, and their physicians thinking they don't need cardiac rehab. Some of the limitations of my study was that I did have a small sample size. Larger sample size can help establish this correlation better, hopefully. In the future, the study can be replicated to see the difference between urban dwellers and rural dwellers, and what we can do as healthcare providers to overcome these barriers for this population. Thank you for listening and have a great day.